Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. Welcome to today's episode of The Golden Hour. I'm your host, Dr. O, and today I'm joined by Elizabeth Cherot, a nationally recognized OB-GYN with over 20 years of experience in maternal and infant health. She's a former president and CEO of March of Dimes and now serves as the president of Lucina, a maternal analytics company, as well as the chief medical officer of United Women's Health. Dr. Cherot earned her medical degree from University of Rochester and her executive MBA from Johns Hopkins. A fierce advocate for women and babies, she's dedicated her career to improving outcomes across the entire journey of motherhood. Dr. Cherot now lives in New Jersey with her husband and 2 children. Welcome, Elizabeth.
Thank you. Thanks for having me today. Really excited to be here.
Oh, I feel honored that our mutual friend and colleague Brian connected us. I also feel honored that your pups are trying really hard to be quiet, but one of them just,
I know.
I love just natural background. So I let them speak, let them rejoice, let them join in when they want.
Well, I always laugh because one of my first recordings I ever did, my home phone rang and I had and I started going, yes, I'm mortified. I still have a landline. Sorry. Right in the middle of my very first recording that I ever did.
Yeah.
So,
Yeah.
So
Yeah, it's all ambient noise. We are not in a silo.
no.
Things are going to happen. I also want the audience to recognize how, yes, your blurb is amazing. You're a badass. You know this. Hopefully you do. But you are still having this conversation with me after like an epic journey. So like, do you want to, you shared with me in our kind of pre-recording, but do you want to share with the audience what it took for you to get here right now?
So I got up at 4 a.m. to catch a direct flight to LaGuardia. And I had to drive. I was in Mississippi, actually, where some of the worst maternal outcomes are and where Lucina is doing some really neat things. And so I was meeting with some team members there and drove because getting a direct flight to Newark with all the construction on their tarmac right now. And so that's happening. Plus, they have all those, right? They don't have enough staff. So I just wanted to make sure that I could get here. So I said, okay, LaGuardia, let's go a little 40 minutes further. Landed beautifully. But I did have a 6 o'clock flight. But to get there, I had to leave at about, I guess this Eastern Standard Time was 4. So you're talking about a 7 o'clock flight, just shifting from Central Time, and then landed, all went well. I was like, great, gonna make it home in an hour and 20 minutes. And the car that I was in popped a tire. So pulled over on 78 and caught another Uber, felt bad for the other driver, but was like, I gotta go. I gotta meet Dr. O today. So that's a little, fun try. It's a fun story, right? That's kind of, I feel like that just adds a little bit of drama, right? But then you just you're just zen throughout the whole thing. Yeah. Exactly.
Yes. And it shows your commitment to this recording. Like I feel very honored already because I know how incredibly busy you are and how much the amazing work that you do takes from you in terms of your time commitment. So the fact that you like caught an early flight, dealt with like various forms of not public transportation, but various forms of alternative transportation to get to this moment, that's commitment. Because someone could have been like, I have to wake up at 4 a.m. to talk to this girl. No, thanks. Let's reschedule. No, so thank you.
Absolutely. I love it. I, wouldn't be anywhere else. So this is, right. Had to
Yeah. Well, I appreciate you. And again, I appreciate so much that you've done for our community at large in women's health. You've had such a diverse and fulfilling career thus far, right? There's many more things that the world will get from and benefit from you, Elizabeth. But what was your story? What made you so dedicated and on this mission to impact maternal health in such a big way, from March of Dimes to Lucina and now Unified Women's Health? What's your story?
Oh gosh, I think if 10 years ago, right around that time I was finishing up my MBA, but my decision to get my MBA was really pushed by my drive, for clinical excellence. And then to say, I need to be the business excellence in the room. I am the provider. And I knew I was having impact, right? And really driving outcomes personally and with my practice. But felt like every time I was in the room with a payer or a hospital, they kind of looked to the administrator, and I kept thinking, I know this business so well. Why is this happening?
Yeah.
And so to a certain extent, I call it my midlife crisis. And another cheaper than a Porsche and a divorce. So,
Yeah.
but truthfully, it was really about validating kind of my knowledge and getting to the table. And I think it was one of the best things I've ever done in my career. And it
Mhm.
definitely Hopkins was a fantastic place to go, obviously, because of healthcare, but really
Yeah.
the trajectory from there was thinking about things differently. And I always say building for what was next. Some of it's serendipity, which I just love, but part of, so I feel like there's been a lot of luck in my career, but really felt like having the impact on a broader scale
Yeah.
was really important to me. And, my whole clinical career of taking care of one patient at a time, building a birth center, I did a really cool project called Enhanced Recovery After C-section, which taught me
Mm.
so much about collaboration and a lot about technology because frankly, I had no idea how to even use a DVR, but I could, figured out how to put an app together to gather, patient data. And then that kind of led to data and what we can get out of it and use it for, but
Yeah.
really with patients at the center of all the
Mhm.
decisions, right, to get to better outcomes and really physicians too, or I would say clinicians. And so it kind of evolved. And so I shifted after my MBA to doing a lot more of the business side. I continued to see patients for a while and a point in my life of doing some really neat clinical stuff with remote fetal monitoring and remote blood pressures and, being a chief medical officer kind of in a role after I don't know if it was a 7-year itch, but a March of Dimes came all across my desk and I was like, let me go interview for this and see what it's like. And I think it is good to always interview. I think
Yeah.
interviewing once a year keeps you on your right for something completely out of what you think is out of your scope. And then
Yeah.
and was lucky enough to land that. And then a few months in was asked by the board to step up as their first physician CEO and was there and really about right making impact
Mm.
on a much broader scale. So I got to testify on the Hill. I got to start a venture capital fund. Got to fundraise, which as a physician is really hard. We can't even collect
Yeah.
copay. I mean, I right? Like I'm uncomfortable asking for a copay, but yet I'm asking for dollars, right?
Yeah.
Big dollars.
Yeah.
And then for personal happenstance and honestly, I just had stuff going on in my own life.
Uh-huh.
Physically, I needed a hip replacement, and I
Mm.
shared with you, my mom became ill, and
Yeah.
I, had a really crucial decision to make, and I, had never really had to pause my career or really think about what is best for myself really in a different way.
Yeah.
And so my mom was, metastatic lung cancer. So please,
Mm.
no one smoke. She quit years ago, but this came back, and it was time for me to take that pause. So
Yeah.
I did, and then when I did, I got an offer to join Lucina, and kind of was able to do that from my mom's bedside and not fundraise and really grow maternal analytics in the right direction to try and make bigger impact. I mean, how could I not say yes to that?
Mm.
And so, yeah, some of this is serendipity. And then, like, yeah, it's crazy. But, a couple months into this year, Lucina is one of the companies under Unified, excuse me. They have
Mm.
3 different companies and that really are one big enterprise.
Mm.
And after being at Lucina for 6 months, 7 months, I guess, almost 9, I think now, but they asked if I would step up to be the chief medical officer. And this is a real opportunity to make such a big impact that I couldn't say no. So, and
Uh,
my mother passed away and
uh,
got to hear that I was going to move on and do bigger things. And she was so proud of the March of Dimes
uh,
as of but I was glad to be able to tell her that was I was doing before she passed away. But yeah, so
yeah.
that's the craziness of my career. People ask me all the time. I would think I was talking to Irina Bird, great doc who is the chairman at University of Maryland. And she looked at me, she's like, I don't think anybody's had a career quite like you. And I was
Yeah.
like, to your point, I'm like, it's not over, but so you never know
Yeah.
what I might do. But yeah, I think certain decisions came up or um, offerings, choices, right? And maybe I lean in more than I lean out. So
Yeah. Wow.
yeah.
What a story. And I know that what I know about you so far from our various conversations and especially this, what 10 minutes we've had so far, it's only been 10 minutes, is that you're the true, like, a true example of humility, like, the fact that you are, like, recognizing luck or serendipity in this journey, in the story that you've had. I think that that is incredibly humble of you, but I think that behind all of this is someone who's incredibly ambitious, someone who's dedicated to serving women and maternal health in not only the sacred moments of those one-on-one clinical moments. You and I both can, like,
Yeah,
sit in those spaces and know when we're deeply connecting to someone heart to heart, soul to soul, but on a grander and larger scale, and recognizing that there's so
yeah,
many different ways to serve this community that we have such a privilege and such a deep honor to care for. I think this little passion project of mine, this podcast, is my kind of first kind of outreach from kind of behind the doors of a clinic or behind the walls of an
yeah,
office to say, how can I have conversations? How can I create community around something that I feel so deeply passionate about? Being able to sit and talk with you now is kind of this hashtag goals moment where I sit and I look at you and your illustrious career that is still on its trajectory and has had so many cool twists and turns that it's an inspiration to kind of think outside the box of the ways we can serve our patients, our community. Because I think I've grown up with a lot of different role models, and a lot of those role models are kind of the traditional
yep,
like physician track, and I there's no issues with that, and I'm not here to also speak against that, but that is an incredible way to serve. Like, when I think time and time again, like, my clinic days that exhaust me the most are the times where I'm like, "No, I'm at my purpose. I've done good today." But I love the idea of being able to kind of think, outside of the traditional box, right? When we go to medical school, we get taught a lot of different, like, algorithms and physiology, and it's really, and I get why, like, it's really just boxed in. We
yes.
don't necessarily get as many examples of the different ways that physician leaders can serve their community as their careers go on. So this is
Yeah,
a great example.
I like being creative just in general, right? And I
Yeah.
would say this is, I mean, I have some habits that are creative, but this is one of them, right? To think a little bit differently, how to approach a
Yeah.
problem differently. I think I approach my career differently. I definitely agree with you. You go through, I was a straight arrow, right? Right from undergrad to medical school to residency. My year abroad was the year that I worked in Alabama for a year in Birmingham, right? I didn't do the junior year abroad that my age group kind of did. So I
Yeah.
would joke about that. I'm originally from Massachusetts, so that's why the year abroad kind of thing. But I think it's about looking at options and optionality of what that is and how do you amplify, which you are doing so beautifully, the maternal healthcare crisis in this country
Mhm.
and really about how we serve women, and I think that's like a beautiful thing, but I think it's
Mhm.
also there's yes, I mean you're lovely to it some of it is absolutely just luck. And then yes, some of it is going after and leaning in and going for
Mhm.
it. And I also think it takes some courage. I mean, I'm not gonna lie, right? Stepping out
Yeah.
of clinical was really it was stepwise for me. I my
Yeah.
last delivery was in 2020. My last patient was about 9 months ago, a little longer now. I'm thinking, yeah, it's not quite a little further than a pregnancy, maybe a
Yeah.
42 week, no,
Yeah.
old school. Yeah, I worked in a maximum security prison, for a
Mm.
while, and for me, that came up in 2020, after George Floyd and felt like
Yeah.
came across my desk, before George Floyd happened, and I was like, "Who would be crazy enough to take this?" Right? Um,
Yeah.
and and it was but at the same time, every time I read it, it was they were desperate, right? Can't find a
Yeah.
gynecologist to help these women, and really, right, the most marginalized in this country, if you think about it. And
Yeah.
so I went with, my ridiculously thick CV and walked in. I kinda got laughed. They thought I was punking them. They thought it was
Yeah.
for a
Yeah,
joke,
like, "What are
right?
you doing here?"
Yeah, no, that was the first question, and,
Yeah.
after getting through security and going through it all, I was like, "Listen, you need help. I think I can help, but I wanna
Yeah.
make sure I'm safe," which I felt completely, and I wanna make sure, I know what I'm getting into, and, EMR system and just doing, really annual exams and
Yeah.
following up on mammogram doing, what we do.
Yeah.
And so, I didn't have to see 40 patients a day because that's just not how it works. The
Yeah.
system just doesn't qualify for that. But I did that for a significant amount of time, and I would say that was probably the most impactful thing that I've
Mm.
done, and it was just good for my soul, right? Like,
Yeah.
I'd drive out of my driveway going, "I don't have time for this," right? Because there's just right? Whether it's the traffic, the blown
Yeah.
tire,
Yeah.
a physician that you're supposed to call, a follow-up email that wasn't getting done, or,
Yeah.
Excel sheet, a performa to get through. But I would pull through those gates. One of the best things about it is that no cell phone, security.
Yeah.
You just walk in with your key to your car, and it is
Yeah.
like, okay, it's somewhat freeing,
Yeah.
right? And so you just are responsible for the patient that's in front of you.
Mm.
And, I may only see 3 or 4 of them, but getting an annual exam, or, getting that Pap done, or did colposcopies or biopsies. And, yeah, I found it. And, sometimes people would just come to talk, and I did for several years throughout COVID. COVID tested a lot, which wasn't fun, but
Sure.
on a weekly basis, which, nobody likes, but it was, sort of that. I started out doing 2 half days, and then I made it a full day. And I think when my husband looked at me, he was like, "You really enjoy this?" I said, "Yeah, I mean, I don't ask what they've done. I don't wanna
Yeah.
know, right? I just wanna take care
Yeah.
of them as human beings, and I think we need to treat each other right, value each other in those ways." And
Exactly.
so I learned a lot from them, and
Mm.
I think for me, getting the patients that needed their care, some who hadn't seen, a provider in years because they just
Yeah.
different reasons. And so
Yeah.
diagnosed a lot of cancer, had to deliver,
Mm.
some really hard news, or
Mm.
watched, a mom, have her baby taken away after she delivered. And she
Mm.
came in pregnant as a prisoner. And then, so it was maximum security, so you saw it all. I mean, I
Yeah.
and a side of the system that I had never, frankly, I mean, I hadn't seen since residency. So in red,
Yeah.
yeah, so it was
Yeah.
interesting, fascinating, and incredible amount of, for those that work in that system to help, those patients, and just a ton of psychology. I mean, you can imagine, right? All the things.
Yeah.
So, yeah.
I mean, I think about the diversity of your career in terms of all the various leaderships hats that you've worn and continue to wear, but yeah, the diversity in terms of the patients you've been able to serve and care for. I think I'm very biased as an OB-GYN talking to a fellow OB-GYN, but that's why I feel so honored to do what we do, all right? That um, the vulnerability that our patients have at baseline,
Yeah.
whether it's someone coming in for their first pap smear, but maybe they have a history of sexual trauma, unfortunately,
Right.
or someone who is marginalized, whether it's based on unstable housing or imprisonment or everything else in between, even someone who is like well privileged and well to do, like there's something
Yeah.
so um there's that happens when our patients come into our office space or when we meet them where they are, if
Yeah.
it's in the prison or doing mobile care for those who are unstably housed. It really means a lot to be able to hold space for patients in that way. And when I say hold space, it really is it's about creating space. Like when
Yeah.
I say hold space, it's when I think about it, I'm taking the least amount of space in that room, in that encounter. Like you said, there's sometimes where patients just want to talk to you. They just
Yeah.
I mean, I've had plenty of my like I'm sure you remember back in your days of like your routine clinical practice. I have plenty of women who are like well in their like 70s who really don't need to see me anymore,
Yeah.
but they just wanna chit chat.
They
And
they
I'm
just
like, "You know what?"
they just wanna
Yeah,
come occupy that space. You're exactly
yeah,
right. Yeah. No.
yeah.
And it's a
And so
privilege,
I
right? It's
is a
totally a
privilege.
privilege. Yeah.
Yeah,
And
and it's just say this to my patients all the time, and I've said it enough on the podcast, but really it's it's a humbling honor to be a human caring for other humans.
yeah.
We're all humans, and we're all showing up in the ways that we can to lift each other up. And so yeah, thank you for sharing your experiences with your time at the maximum prison. There's so many experiences that you've had, Dr. Cherot, that I have to keep going. I have to cover all of them. One of the experiences I'd love to touch on is your experience as a mother, right?
Uh,
How, we are OB-GYNs. I myself,
sure.
like to say I mother others. Like I really am nurturing
Sure.
to those who I have the honor to care for as patients and my friends and family, but I'm not a mother yet. But how has your experience as a mother influenced the way that you approach maternal health and the ways to improve the care that we're currently giving our patients?
Gosh, that's like how long do we have? Think
We've got 2 hours. Let's do it.
yeah, it's everything from my approach to talking to another mom about even, like, figuring out daycare, childcare, or, to when to go back to work, to being the resident who said, "I'm sorry you had an episiotomy. Take your ice pack, you'll be fine. It's not that bad, a little bee sting," to going, "Oh my gosh, what is that cigarette burn on my," because that
Yeah.
I was right? I mean, I after having my first child, so
Yeah.
and then the emotional roller coasters. And I was desperate to get back to work. I was like, "Oh, I gotta get out of here. I'm not gonna be able to handle this." And then having the supportive family. So all the things give you the perspective, I think, overall. But so I think all of that happens. I also had preeclampsia with
Mm.
my first child and, in total denial that it was all happening while my husband was like, "I think you're sick," and I was like, "I'm fine. I'm totally fine." Yeah.
Yeah.
And I had my first child at University of Alabama down in Birmingham, and, I was, you know, kind of working like crazy and like, "Okay, gotta finish my call because I don't wanna impact the call schedule and the partners," and, you're putting everybody
Uh,
first, and then all of a sudden you're like, "I'm a puffball. I can't s" I would did a vaginal hysterectomy that morning, and I think that was, like, one of the last ones I ever did, right? They
yeah.
all went to
Yeah.
yoga,
Yeah, yeah.
but I had this scotomata and was trying to figure out, like, how come I can't see around this? What is this?
Yeah.
And just, you know, is that denial? Is that just sort of not know I mean, I just think I was just on a mission to get patient and
Yeah.
my partner, Dr. Andy Lemons, who's just was lovely, just sort of said to me, "You know, think you should go up to labor and delivery and get your blood pressure checked." And
Gosh.
he's like, "And take the elevator, don't you dare walk." And I was like,
Yeah.
"Who are you to tell me?" Right?
Yeah.
Oh, right? So,
Lo and
um
behold.
lo and behold, and then I was like, "Oh, they're gonna put me on bed rest, right? They're just gonna put me on bed rest." All the time, and I was like, the next thing you know, you're being induced, and it's all magnesium and the hydralazine and all the things. And I'm inpatient next to the patient's room that I had seen over the weekend and admitted, right, for preterm
Yeah.
birth. You're just sort of like, "Oh,
Yeah.
this is all happened to me." But
Yeah.
yeah, I think it's humbling in that way. I also think, it's relatable and you can have those discussions. I would say as a mom, though, I think some of the most impactful for me, so I have 2 children, was really and they're about 18 months apart. I didn't really do that child spacing thing very well.
Okay.
So again, right, like, and then but having like, when you go through it personally, you have some idea, but I think it's just, like, I really didn't realize how hard childcare is, right? And I was like,
Yeah.
I don't wanna say, maniacal might be the right word, because once I found my person, I was like, I can't let her go," right? Like,
Mm.
and I'm not gonna change this, and it's gonna be forever, and, you realize
Yeah.
it's not always the best thing for your child, right? And
Yeah.
maybe socialize thing that might be great, it's great for your schedule, and so, it orients you in a different way, and it
Yeah.
oriented the conversation when somebody would, and I would probably the hair would stand on the back of my neck when somebody asked me, like, "What do you do for childcare?" And I was just like, "Well, it's not me, obviously, right? I'm working." And
Yeah.
I would get super defensive
Yeah.
and in a weird way, I think it was just sort of
Yeah.
like I was like, "Of course I'm not home with them," right? And so
Yeah.
and I wanna be, or do I? I don't really know, and I
Yeah.
kinda realized, like, no, I like what I do, and my mom would help a little, and, we had a great kinda and then I pivoted and shifted. I used au pairs, I used nannies, I used teenage kids over summers, and it was super stressful, but I kinda got to the point being able to talk about it and share it with other moms and patients who would be talking about it, be like, "Yeah, I did not handle that well." Like, it took
Yeah.
me a long time to kinda go
Yeah.
and, and then terrified when they got their licenses to drive, like all the things, and so my craziness of following them the first day to school on the school bus didn't seem like nothing when I was, like, driving down the
Yeah.
highway, like, "He's not using his blinker." I mean, so you you know, so I think it
Oh.
it humbles you, it gets you to a point of being able to be relatable, but I also think you I would also say going through the birth process, I feel
Mm.
giving you the perspective of a lot of things. I feel really lucky I've had children. There are people who
Yeah.
really struggle to have children, and then,
Yeah.
yes, I didn't have to have C-sections, and boy, do I feel lucky about that. And when patients say how important it is them to not have one, and I think it's a loss of control that right? There's a
Mhm.
lot of that and a lot of discussion, I guess, in my head around trust.
Mm.
I loved my 2 doctors, but I had the ability to really know them well and know that they cared, know they were sincere, know they were competent and reliable, and that
Mhm.
I could build that trust really quickly, and I just think, "My gosh, how does that happen when maybe
Yeah,
you've never seen the patient before?" Right? Like, the patient's never seen you, and so how do you garner
exactly.
that and get that, and how do they know that you know you care, you're competent, you're
Yeah.
reliable, like, all the things that would make you trust them, and so
Yeah.
and I've worked on that in my career, both in the business side too, actually, and so
Yeah.
there's a book called Little Book of Trust, and that kinda really took and I applied it really to clinical, and now like I said, I more apply it to business, but or maybe the physician kinda stuff, but with an MSO or with the things that we do, but at
Mhm.
Unified. But I think of it as that is the bedside, right? I'm about to put forceps on your baby. Let's have that discussion because yes, I've trained in forceps and
Yeah.
on a patient I had to get them to trust me.
Yeah.
And so, yeah, I could joke and all those things, but I think being relatable and really having honest conversations and getting to the care and the sincerity and helped in those ways. So,
Yeah.
that may not have answered your question or what you originally
No,
said.
it did, and
Pretty
it gave me more to ask, so I'm just gonna keep going. No, because I think about I mentioned earlier, like, the vulnerability of meeting a patient in a clinic room
Yeah.
or a prison room, wherever it might be, man, but the vulnerability of meeting a patient in a labor room or emergently in an emergency room, right? In this acute setting where they're
Yes.
suddenly, like, you're a stranger to them, and you're right, I oftentimes reflect on the extreme privilege it is to be someone trained in medicine, to know my colleagues well, and know that if I was ever in an like, emergent medical situation, I would likely know someone in some way
Yeah.
connected to me, so I would feel safe, or knowing that I could just advocate for
Yeah.
myself.
That's
And
right.
so, I think about like the golden minute, like that first interaction of like, okay, what can I do to earn your trust?
Yep.
What does it look like to create a space where you feel like, hey, this was totally unexpected. That locus of control I was trying to garner by making this like epic 10-page birth plan that
Right,
didn't work
right,
out the way I
right,
wanted.
right.
Now this like random OB is coming at 3 in the morning saying that, it's time for a C-section, or whatever it is that happens. And so I really, I mean, this is going to be a theme of our conversation. I really do recognize what a privilege we have to walk into those spaces and make people feel safe, not only in our technical skill. Like I don't that part I like fully trust. I know for all of us we are so well trained, but for that patient and their family in that moment, they don't care about our pedigree or our epic CV. They care about the person there that's in front of
Yeah.
them and whether or not they truly care, and like how we can meet them there.
Yeah, I
And
think
what
honoring that is really
Yeah.
sometimes, right, in split seconds, and
Yeah.
sometimes it's, right words choices, right behaviors, all of those things, and but I think it's really important, and I think it's something that, some people do really, really well, and it sometimes is a connection, and so it's just always I've just thought a lot about it over my career, and I think it's kind of the here and now of what
Mhm.
happens, like, right, and I remember somebody I think I had forceps in my hand, like, "Do you know how to use those?" And I was like, "Yeah. Yes, I do."
Yeah,
Right?
yeah,
And that is the only answer at that moment, right? It was sort of
yeah,
that, and, but I, later sort of said, "I'm glad I answered, like, yes, yes, I do." And it wasn't,
yeah,
like, scoffing at them for
yeah.
asking or really judging that they were asking or but I get the verbal, like,
Yeah,
confirmation, right? And so, and I thought about it, I was like, "Yeah, I think that was a moment that they had to trust me, right?" And
yeah.
nurses used to laugh. I would walk out of a room and say, "Thank you for trusting me."
Oh,
That's how I
yeah,
said goodbye to my patients,
yeah,
after delivery, right? Sometimes you're getting pictures and the rest of it, but I made sure
yeah.
I verbalized to them, "Thank you," even if it was,
Yes.
routine vaginal delivery where you're just sort of
Yeah,
high-fiving on the way out, right? Like, this is
yeah.
all,
It's all
because I think
good.
it's really important to recognize that that was a trusting thing that they did on both sides.
Mhm,
So, anyway,
mhm. No,
yeah.
I think you and I are, kindred spirits in many ways, but yeah, that thanking them is one of my favorite things. I just saw one of my post-op patients yesterday, and that
Yeah,
as I was walking out of the room, I gave her I'm glad that we're in a place in the pandemic where I can start hugging again, because I
I
do like
know.
to give my hugs, and I just
Yeah,
gave her a nice big hug and said, "Thank you for entrusting me with your care," right? Like, that
it's
she,
privilege.
at that
Yeah.
moment, made a choice and trusted me with her body and trusted me with her skill sets. And I think the more gratitude and appreciation we bring to our work as clinicians, the better we could combat like the constant pull of burnout,
Yeah.
right? Like I have to
Oh,
like
yeah.
that's always in the back of that's
Totally.
always in the back of my mind. Sometimes more so in the forefront. Right now, I just came back from an amazing week of CME in Costa Rica with like
Oh,
daily yoga.
cool.
So I'm like I'm the
Oh,
opposite of burnout
cool.
right now, but
Right.
talk
You're
to me in a
you're on
week.
the top of the hill, right? Of
Yeah,
just looking
exactly.
out, like, this is great
Yeah,
stuff, and all the
yeah,
things
but
you can do after those learnings. Yes, I get that.
exactly.
Yeah.
But the gratitude piece, I think, it helps keep me in check. And so for any clinicians, especially those in women's health who are listening right now, I think it's even those days where I'm like, I am wrecked, I am exhausted. How can I see any more people? I'm like, but man, they chose to see me, or they were so grateful that they got urgently added on my clinic. I have to be
Yep.
appreciative that I can meet them where they are. Another thing that you brought up that I really would love to speak to is this conflict of identity, the identity shift that happens postpartum
Mm,
in motherhood, right? That
mm,
I keep bringing this up on the podcast, this idea of matrescence, right? That adolescence is our epic first transition hormonally,
mhm.
physically, emotionally in our teens, and then matrescence is this huge transformation from pregnancy beyond that really is clouded by conflict and identity shift and guilt and ambivalence and all these different things that people don't generally speak about. And one of the goals of this podcast is to create a safe space so that we just talk about the
Sure.
things that otherwise we might kind of push away in the closet. And so I appreciate you really bringing up like how it was for you, being someone who was career driven. Yes, you were intentional about also being a mom, but you wanted to be a mom in your own way.
Yeah.
How did you deal with those identity shifts? Well, how did you deal with that? You mentioned kind of feeling guilty, being like, well, yeah, I'm not home. I have someone who I trust caring for my kids right now. How did you deal with those moments?
Yeah, I mean, so it's interesting. I think, first of all, I mean, so I've been married for 30 years and I married the right person. And I say
Yeah.
that it's a lot easier and clearer now than ever.
Yeah.
And I think some of that was, my husband and I are both doctors, and I think we kind of went through like the conversations about um money more so than we've had the conversations about how do we want to raise our children, right? Like it was
Mhm.
funny, and I was like, "Oh, that's
Yeah.
interesting." I really, why did we have the conversation about money, right? Like, and religion, right? Like, sort of, it's like we didn't really get to the kids part.
Yeah.
But I think part of it was just sort of where our my career was at and my husband's career was at the time, and so just to be transparent, my husband trained as a plastic surgeon. He has done a lot of Operation Smile, cleft lips, and cleft palates
Mm.
overseas, and then shifted to teaching. And one of the things I don't even know if I shared with you, my daughter is a type 1 diabetic,
Mm.
and so when she was 8 years old, we missed her diagnosis, by the way, both of us.
Mm.
Didn't see it. Like,
Yeah,
I was, and
yeah,
at one point, I'm like, "Oh, she either has cancer or, like, there's some," right? Like, both of us said, like, "This is
yeah,
not good." And so she
yeah,
went to the hospital in DKA, and she was 8. I mean, she's now 20, so,
yeah,
and does a great job, and her math skills went through the roof because of her.
yeah,
So I wish, yeah, but so that's the benefit,
yeah.
and we kind of shifted to who's like, one of us felt like we needed to be the priority or not, right?
Mhm.
And I say that of like we had a conscious conversation of who's gonna be around to be able to change pump sets, right?
Yeah,
Bring insulin in when it needs to, and I'm in the middle of labor and delivery, like, how is that gonna work? And so it was sort of, and my husband's like, "I got it." We're in this
yeah,
together and we are parenting together. And so,
yeah,
yeah, check the box, like, married the right person, right? But
yep.
also, you know, so he went back to get his teaching certificate and now teaches Latin at a public high school, Princeton High School,
Cool.
and so in New Jersey. And so that decision was also made together of like, I was like, "Dude, you are giving me the root word of everything my entire, like, even the root word of Tampax when I buy them," right? He's like,
What? What's
"Tampon,
the root word?
to tamponade." Isn't that brilliant? Like, some marketing.
Duh.
I know, right? This is our
Yeah.
first date, by the way. So
He's a
not like
keeper. You could
yeah,
tell
I
early
mean,
on.
I wanted to go to the grocery store, by myself to go get my
Yeah,
Tampax. He's like, "No, no, this
yeah.
is a great conversation." I was like, "I gotta go buy Tampax." I'm like, "Dude, like, who does this on a first date?" And the lady in the checkout market looks at me, and as he's going on, he's like, "Tampax, Tamponade, ooh," and it keeps going, and she's like, "He's yours?" And I was like, "Well, it's a first date." He's like, "Some first date I'll never forget." We told our children that story because I was like, "I don't know about this one," but
Yeah, yeah.
here I am 30 years later, but we really made that conscious decision to,
Mm,
and I don't and it evolved over time where when he went back to school to get his, teaching certificate to be able to teach in the state of New Jersey, I kinda said, "Whatever you need to get that done,
yeah,
let's figure it out," and so I think these were really honest conversations about it all, about kind of all of that, but I also think as a parent, like, we were locked arm in arm, and I don't know how I mean, my mother raised 4 of us pretty much by herself,
yeah.
and yeah, and and we were all, like, 12 months apart. She didn't do that child spacing either, that's where I got it, but I don't know and she worked full time, like, I don't know how how to do that alone, like, I just
Yeah,
I mean, like, I have such respect but it anyway, taking a step back, yeah, I had to be really honest with, like, I like to work.
yeah,
I like to do things. I like to be busy at work, and just as I like to be on call, I did. I liked being on call. I liked, doing my job and being and I
yeah,
we delivered, about 1,200 deliveries a year in my practice. So, and 1 in 6, you can say it, that's like 200 babies a year. You're busy, 250
yeah,
and so I think that's the math. Anyway, so
yeah.
I right? I was like and I would spend the weekends or dimes on call, and yeah, my husband would bring the kids. I mean, I remember breastfeeding in call rooms and doing all those things, and so there was the sense of guilt as people asked questions, and then I kinda got to the point of, like, this is actually working, right? Like,
Mm,
and okay, I made it I really tried to anything post-call I tried to get to. Yes, I slept through, like, a couple of bus drop-offs and things like that, Um, but I was really conscious about someone once said to me, "It's not about the amount of time, it's the quality of the time that you
yep,
spend with your child," and I I kinda had to I didn't believe that. Like, it took me
yeah,
a long time to say, "That's so true," and
yeah,
I started shifting and honestly, when I look back, I think, "Okay, when they were young, I probably didn't need to be there as much." It's really high school and middle school where I would
mm,
have real conversations with my children, and I felt like, the more I picked them up right after school because I would get all the information, and actually, I did what I'd call mommy and me days,
yeah,
something my mother would do, which we called them R&R days, rest and relaxation days.
yeah,
And you got to pick what you wanted for breakfast. My mother would order, like, a pizza if you wanted breakfast, like,
yeah,
sleep in, and it was school day.
yeah.
And so she made sure she took that quality time with each of us, and,
Aw,
and my daughter, just reminded me, she's like, "Remember we'd have mommy and me days?" I was like, "Oh, yeah, that's what I would call them." Right? I would just take a day I'd take a day, and whether it was
yeah,
post-call, but really tried to make it not that, like, something
yeah,
and we would just do something, whether it was, like, go to a museum, or shopping, right? Or, just
mhm,
like hanging out with my son and we'd just plan a picnic and a bike ride, kind of thing. Nothing monumentous, but quality time.
yeah,
And then I really realized like as much as I could get to them in high school, right at as school got out, because that's when they would vomit everything at me, in the car
yeah,
ride. And I, driving off the road almost with a couple of things
yeah,
like goodness,
yeah.
right?
Like, "What?"
I'm like we're talking like now.
Yeah,
And when I was driving and my son was taking a finance class, he's like, "You're renting this car? Do you know about compound interest?" And I was just like, "No, no, no, no." I mean,
okay.
right? Like, so you're just like, "Oh, you wanna have a conversation about interest? Let's
Yeah,
go." Right?
yeah,
So
yeah, yeah,
all the things, just I made sure and I did have that moment of like, I was a latchkey kid. I didn't, really have but there were times when my mother really made sure she checked in and was really
mhm,
conscious about it. So it was something in the back of my head to do the same, and,
mhm,
so I think, like, those were times that, like, I'm so glad I did, but I definitely there was that pivot of feeling guilty to, like, "Okay, I'm really okay. We're all okay," and I did have the support of
yeah,
my husband. I mean, there's no doubt. but he was working too. I mean, we're both working parents. And so we figured it out. It just sort of, it took a little bit. And I would say the beginning years, I definitely felt that guilt, and then finally kind of let it go. I don't
Yeah.
know that there was one particular pivotal moment that made that happen, but maybe it's, you start seeing your kids thrive, and that helps.
Yeah.
So
Like
the type 1 diabetic, and then I got a kid with ADD, so there were
yeah.
always, there's always something, right? And every
Yeah.
family has something, like, right? Not
Exactly.
every I think that's the other thing I realized, like, maybe it was doing math homework with my son, right? I was like, "There's gotta be a better way. Like, somebody's gotta tutor this kid, because I'm like, I don't even learn math this way,
Yeah.
and this isn't working because 'cause I'm frustrated, like, this isn't the
Yeah.
type of time," and then my daughter helped my son, which was
Oh,
amazing, right?
yeah.
And you're sort of like, "Wow, this is okay." Like, we're
Yeah.
all, and we
We're
just
all
need
okay.
yeah, and we just need to be good people, right? That was,
Yeah.
in the beginning, I was like, "Please feed yourself and clean up after yourself," and, then it was like, "Okay, now I just need you to be good people," and they
Yeah.
are, which is really nice.
Yeah. Yeah. No, what I appreciate about that reflection is, well, number one, you honored yourself in that. You found a great partner early on who knew the root terminology behind Tampax. Great, great find. But more importantly, that partner who saw you and helped you prioritize the you in you. I think there's something so selfless about parenthood in a way that I, again, have yet to experience. And when my husband and I, who both of us are very ambivalent about whether or not we want to be parents, we have many different conversations. And I talk about how, there's an evolved version of myself. I think we're all ever evolving, but there's an evolved version of myself I haven't met yet, and I might not meet if I don't become a mom. And that version is probably a very selfless or more selfless version of the current me. But in order to give and give and give, and again, I'm going back to at least my children, the people I mother, aka my patients, and the people that I love. Although yeah, I feel like I
Yeah,
am mothering my
you
parents
do,
now
you
too because
shift,
they're aging. Yeah, I'm
you
mothering
shift,
them.
that
Yeah.
shifts. My mother
Yes.
actually called herself my daughter at one point. I was like, "What?" And she was like,
Yeah.
"How did that and just like, "It is
Yeah.
happening." Yeah, so,
Yeah, yeah.
sort of.
But as I mother others, I realize too, though, that in order for me to give and give and give, my cup has to fill up
Yes,
too, right? And so you
absolutely.
were filling up your cup by honoring your dedication, your profession, and the things that like make you feel engaged and intellectual and skilled, and all the things that are energizing. And I also really just appreciate that reflection of quality over quantity. Like I think I'm making an assumption because most OB-GYNs I know are like type A and like
Mhm.
very like, we must get this done and there's a checklist and I'm gonna check
Yes.
all the boxes.
Yep. Yep.
Like that just intense energy. And I love that intense energy. And that's why I love being an OB-GYN. But it's just like recognizing that like moment when you like let back and be like, you know what? Like I'm gonna just have like a really great day with these kids. And look, like they've turned out great and look like how they love each other.
Yeah.
Amazing. Done
Yeah,
deal.
no, I would do the silliest of things. I mean, I don't know French very well, but I did take it in college, and I would pretend I was a French waiter just to change it up, right?
Yeah.
And it was just like, and my kids recently said, "Do you remember how fun that was?" I was like, "Not really." Like, my French was terrible. I probably didn't call everything the right thing, and they're like, "It didn't matter. You made it." Like, and it's funny how they reflect back on it, right?
Aw.
Now that my children are, I guess, 22 and 20, I
Yeah.
like hearing about Mommy and Me Day, hearing about sort of being the French waiter,
Yeah.
and the different things I would do. Part of it was just, you know, making sure we were connecting and right, and getting some of the, we were having the fun. It needs to be
Yeah.
fun. It's work, definitely work, for
Yeah.
sure. And I would definitely say it's the best thing I ever did. So,
Yeah.
yeah, for sure.
Thank you. Thank you. So I'd like to take a moment to tell you this is my passion project based on years of experience as an OB-GYN doctor. I aim to empower moms and moms to be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. So we're going to shift from the personal
Sure.
now back to the professional. From your work with March of Dimes and the work that you continue to do with Lucina and your newer position at Unified Women's Health, what would you say are the biggest challenges that women are facing in pregnancy and postpartum? And I recognize this is a very hard question
Oh my
that
gosh, that's
can lead to
huge.
another hour-long conversation, but for you, with your vantage point, it's an incredible vantage point that you have because you're at tables that most of us OBs and midwives aren't at. And for the patients that are listening, what would you say are the biggest challenges?
Oh gosh. There are so many. But
Yeah.
I would say access is one of them.
Mhm.
Right, and you can talk about maternity care deserts, right, and those are in cities as well as in, rural settings, right, where there is no provider. It's 1 in 3 counties in the United States. So imagine having in South Dakota to drive 150 miles for your prenatal visit, which, by the way, may be 5 minutes, and then you turn around, and ACOG just came out with like, "Hey, we should revise prenatal care," right? Because it was all these 14 visits were set up by, whatever, not this turn of the century, but the prior by like a
Yeah.
lawyer, right, by the way.
Yeah.
So,
Interesting.
yeah, I was a
Yeah.
history of science major, so yeah, right, got into all this, like, "What?" And
Yeah.
so, how do we put the patient at the center of it, right? And the provider, right? So
Mhm.
how do we and I would say our patients are getting higher risk and higher risk and higher risk, right? And we know that from the data. COVID, certainly the blip, but they're still right? We sort of
Mhm.
step back a little, but they're still adjusted. And I think the cost of care is skyrocketing, right? And we haven't been able to figure out how to manage, right, the right care, the right
Yeah.
utilization, right? And I think all of us are trying. I mean, I
Yeah.
would say the system's messed up. Let's just put it
Mhm.
out there. So to me, access is always going to be an issue because it just,
Mhm.
the fact that we rely on our jobs to be able to get healthcare is just fundamentally like crazy. And you think of like Europe and how they're taking care of. Anyway, I'll stop. So
Mhm.
about that soapbox, but uh, access is a big deal. The cost of care is too high, and we've
Mhm.
got to figure out, especially in maternity, how we as right we know there's not going to be enough obstetricians to take care of the population, even with the birth rate being flat. There are not enough that want to go into this. We
Mhm.
also we really got to support midwifery. We have to do that. And I was trained with midwives in Rochester, and they were fundamental. I had 3 midwives in my private practice. I built a birth center because I really do think routine care, if I worked at the top of my license, I wouldn't have done all those, easy deliveries. I want to call them easy, but they're not easy, right? In the end, but they're what I mean is like working at the top of your license, and we probably have to shift it a little bit and figure that out. And I think they're incredible challenges for Black women in this country. If I didn't tell you, I come from a mixed family. I'm very passionate about the fact that Black women have the worst outcomes in this country. Black babies are 2 times more likely to die before their first birthday than their white counterparts. That's a problem, and we aren't putting moms and babies at the center of any of our decisions in healthcare. Listen, I think in maternal healthcare, and I would say women's healthcare, a lot about access, right? So when mom has to drive 150 miles to, a prenatal visit that she probably needed for 5 minutes, I would say we also just the way that our prenatal care is structured, not great.
Yeah.
Also, the outcomes for Black and brown women across this country are not good,
Mhm.
right? And when you focus on not just mom, but baby, the statistics are appalling, right? And then you start to look at moms that have right, really complicated care, or they've got hypertension, diabetes, et cetera. You start laying those in, preterm births are skyrocketing, and more for Black and brown women. So there's something completely broken within that system. Then you shift to the cost of care, and there's just ways we could be making this better. I would tell you that I also kind of am shocked by the amount of data we don't have or that we haven't
Yeah.
leaned into. I think value-based care really has right? Everybody's focused on Medicare population, and we're not really looking longitudinally at moms. I mean, imagine, right? Pregnancy is the stress test, right? You have
Yeah.
hypertension, you have diabetes, right? The hypertension, 8% of our pregnancies, those are women who are going to have cardiac events. They're more likely to 10 years later. So why aren't we doing
Mhm.
a longitudinal program there? Right? Why aren't we
Yeah.
giving them all blood pressure cuffs and saying, continue to take your blood pressure, not just during your pregnancy. And then, and I would then tell you when I start thinking about diabetes, the same thing, right? They're all at risk
Mhm.
as well, as you know. And so why aren't we doing whole women's care?
Mhm.
Why aren't we really looking at it as a longitudinally? And we think of pregnancy as this one episode, or not, or right? And we know that the infertility patients have the higher risks, right? So there's so many ways to risk stratify this. And again, maybe this is my Lucina hat coming in that now I'm approaching it differently of saying this is the data that we just aren't using or aren't getting to, and it's just like we haven't been researching them, right? We
Yeah.
just in the '90s research. I mean, that's, like, crazy that in the '90s we decided that
Yeah.
women should be researched differently. And women make the healthcare decisions in this country, right? They make
Yeah. For their
80% of the healthcare
families.
country. So why aren't
Yeah.
we right? And we finally got expanded Medicaid to really encompass a year, right? Like, we deserve more, right? We deserve
Mhm.
better, and I hope to be part of really restructuring that as a construct for moms, babies, but for all women.
Mhm.
And so I think from where I sit from March of Dimes was opening the eyes to not just the racial issues and disparities across this country, but the systems to try and affect that are education, really getting into advocacy, something I'd never done before, thinking differently about investing in femtech. So, really, startups. We started a venture capital fund at the March of Dimes, something new and novel, but really kind of focusing on those are the things. Sorry, I just swiped my microphone um, for all of you now awake, but
Yeah.
we need to right focusing on we need more solutions and should have more
Yeah.
options. And I think the idea that investing in women's health is a really, really good idea.
Yeah.
And I think that where I sit from Unified, now we are, 2,900 providers, across multiple states, working with Lucina, which is really a maternal analytics that really takes payer data, identifies patients as high, identifies them in the first trimester and then really risk stratifies them, thinking about can we do that even more broadly, um,
Yeah.
as I just mentioned, right? And so this is not this is all known. I'm not introducing something new, right? Like, this is
Yeah.
not like, the Cherot is a right? Like, Cherot's like, this is all everybody else we've done this work. We know this. And so
Yeah.
how do we really transform women's healthcare? And I think, and get the attention of, of both policy and private sector, all the right? And really could change the health of this country
Mhm.
fundamentally. And so, listen, when I was operating, I used to joke. I was like, "Gosh, I wish I was DeBakey. Having a forceps named after yourself, how
Yeah.
cool."
Yeah.
No, I hope there's I can look back on my life, which I hope will be many, many, years from now, but look back to
Yeah.
say, that this is where the pivot happened. This is where the change
Mhm.
happened. And so we've a while to still go before I think it happened. But I think from the vantage point I've seen, I think we have to, right? We have to kind of get there. And otherwise the outcomes aren't going to change.
Yeah. Agreed. I think
There's probably a
I
lot in
think
everything I just said, but yeah, so
no, there is a lot. No, but I think back to, my young, naive self when I was still I think it was my sophomore year at Stanford, and I still I had been on the track to become a doctor for a long time. My dad was a doctor, so I
oh
grew up
well,
kind
yeah,
of, you know, hearing him and also just being a nerd. So I loved math and science. I was like, this is gonna work. It's meant to be. And then of course you show up at Stanford and they want to weed all of us pre-meds out. So you have like biochem and
I
physics and all
know.
this stuff that was really hard. Yeah, you
Yeah,
went
and
through
they
it too.
start
We all
ranking you. Did you get ranked?
yeah. We didn't get
Hopkins,
ranked.
they
Thank
rank
goodness
you
they
by your
didn't.
so this is
Rude.
mean, right? This is the '80s, so excuse me, I'm
Yeah.
old, but they ranked us by our Social Security number. And, so your first chemistry test
Yeah.
was column 1. I'm in column 1, right?
Yeah.
'Cause you're at
Ouch.
Hopkins, right? I'm
Yeah.
on column 3,
Yeah.
right? So, yeah, it's a lot coming out of a
It's a
high
lot.
school that, you think you're yeah.
You're the best.
Yeah, I
That's
know.
the
That's a humbling
crème de
moment.
la crème.
Yeah,
Yes, very
yeah,
humbling. And
yeah,
so I remember, I was in my ebb and flows of like pre-med or not because they're trying to break me. They didn't rank me,
yeah.
but they were still trying to break me.
Yes.
And sitting in this lecture, and I was a human biology major, and sitting in this lecture where I first got exposed to this concept of health disparities, and that I am a daughter of Nigerian immigrants. I
Hmm.
grew up in West Virginia and then Virginia. And so I had my own experience with macro aggressions and racism, but I don't think
Sure.
as a kid I've truly understood how race and ethnicity played into health outcomes. And I still remember this lecture where they compared the birth outcomes of a West African woman to a U.S. born woman, and kind of making this comparison in a generation. What I did is I projected. I was like, well, my mom was born in West Africa, and my
Mm,
sister and I were born in the U.S. And then somehow, even though my sister and I are incredibly educated, she's a doctor too. Our education and our is actually counting against us
yeah,
as women of
right.
color. And so that statistic, that data, that study was from the 90s. Nothing has gotten better. We're more aware.
Yeah,
It's part of the dialogue. We have amazing things like Black Maternal Health Week, and not to throw around a term that's overused, but people are woke, right? We're very aware, and we're not couching it just to, you know, like, oh, it's just genetics, or like that person
yeah,
just didn't follow up and it's on them. And no, there's a systemic issue, but it's that feeling that, man, the needle still has a ways to go.
yep,
I think, there are many things that inspired this podcast. One of it was that recognition of going from a trainee being like, I'm a doctor. This is what it looks like to be a doctor. And then actually being a doctor and being like, oh, this system that I'm doctoring in,
mhm,
excuse my language, is a little fucked up. Like, it's not perfect. It's trying its best. It's a large country. It's a diverse country, like, especially within women's health. Like, we're trying, I want to give credit to those who initiated systems, and that, yeah, I believe that there was good intentions, but we can do so much better.
so
And
much better.
so
Yeah,
from my frustrations, and I too found a great partner, my husband, who's an entrepreneur, and
cool.
he starts companies. And so when I came home and was venting to him time and time again about my woes with work, he's like, do something about it. I was
Yeah,
like, what do you mean? He's just
yeah,
like, stop complaining, like, make something, create something. And I just stated, and I birthed the podcast. But
that's awesome. No,
I say
listen,
that
that's what we
all,
need is to amplify, right? I think
yeah, amplify the
and a
voices.
lot of times people think, "Oh, you're just spitting out the numbers." It's not just the numbers, but your point is we haven't changed it so far, right?
Mhm.
And we there's lots of different things out there that are, maybe working, not working. We need to study some of them to make sure, right? And then really
Yeah.
amplify those that are working. And I look at some of the data that's come out, I think it was Malaysia that started doing home care, right? So they're shifting back to, right, the doctor bag going, which I've always wanted, by
Yeah.
the way, right,
Yeah.
to go to because my pediatrician had a doctor's bag, right? And
Yeah.
so going to the home and doing the postpartum visit, right? And getting in the
Mm.
home and seeing from a vantage point, right? It's very different from what you
Yeah.
see there, and they changed their outcomes. And it didn't cost them a lot, right? And they hired midwives, and they hired doulas, and we, of course, think in the United States, we don't need all that. Well, yes, we do. And
Yeah,
so
we do.
and we've taken the power away from women, and we need to change that.
Yeah.
And that's a real that's a dynamic, I think, that has to change first, and
Yeah.
that's the real hurdle to get to, and so how do we do that?
Yeah.
I don't have all the answers, definitely.
No, but at least we're talking about it.
Yes, that's exactly right, and I think March of Dimes tries to do that by their education, right? By doing their advocacy, really getting out, and, I mean, they pull a ton of data in that maternity care desert report. It's
Mhm.
brilliant. If you haven't seen it, you need to go to marchofdimes.org. It's and you can drill in it, and it's free.
Yeah.
And you can look at your own hometown, you can look at, somewhere else across the country that you've been to, and you'll be shocked, and you'll even see cities where DC sort of scared me. How many
Yeah.
trains, planes, and automobiles does it take? Well, my favorite is my kids at the time were like, "Can't they just Uber?" I'm like, "No, you have the privilege of Uber."
Yeah.
Right? And
Yeah.
so a fascinating conversation with them at the time as I was, you know, running the March of Dimes, but really about and so that they have a real cities have deserts too, and
Yeah.
so, and trying to get to, clinics with, birth control, right? Family planning,
Mhm.
all of that's in there, and it's just, it's a chock full of data just to kind of churn through, and so I think,
Yeah.
gives good insights.
Yeah. Yeah, I mean, I think about where I practice locally. I'm not only am I an aspiring podcaster, but more importantly, I'm the medical director of our women's health department. And so It means that I'm having these meetings with our greater organization to plan strategically of where we're gonna grow our practice, where we're gonna put
Yep.
clinics, and even in the Bay Area, Bay Area, there's San Francisco across the bridge, Oakland, Berkeley is where I primarily practice, but it's one of the areas that has the largest growth of families. So many people are making that mass exodus from more expensive areas and moving to the East Bay, which is brilliant, which is perfect. But then we have these huge gaps of, yeah, to use your term, like
Yeah.
care, maternity care deserts. And so I will definitely finish this episode and go to the Marshall Times website and be like, let me map out our area. And like, I
2
think
things.
I
You
know,
go to the website and then you donate.
yeah,
And people
yeah,
look and they don't donate. I mean, listen, it can be a
yeah,
small amount, like, it's important. It's really important.
yeah,
So,
yeah.
to be able to keep fueling that.
Yeah, and what should we do with the data, right? Like you said, one, we do need more research to get more data, but we have a lot of data, right?
Yeah.
You and I have both read those papers. Those are the papers that got me through
Yeah.
college, medical school, residency, like,
Yeah.
of just, like, all the disparities. We know it's there. Like,
Sure.
what do we do with the data? How do we
So I think one of the
act?
things that, I think March of Dimes is working on actually right now, and Lucina is doing in part, is really thinking about so what makes the biggest impact? Like, just what does it? Is it getting home security, right? The SDOH needs.
Mm,
And I mean, I have my thoughts, but we don't know.
yeah,
So is it doing the transportation? Yes, transportation gets you to the clinics, and the return on the investment for doing that, you can get, the clinic can have, no matter what it is, right, all the slots utilization, and so the value proposition there of partnering with an Uber or a Lyft or a program, and March of Dimes has one in Broward County in Florida that would get patients to their visits. That's an easy, right? Like, makes sense. Does it change the outcomes? Now we know,
mm,
right? We know prenatal care does, right? Getting into your visits, especially an early visit or getting all the vaccinations, but getting to those outcomes, I think, is where I start to shift, where Lucina is really trying to say or investigate and look into what makes a difference. And my bias is going to be some of the behavioral health, right? Because so if you start looking at the data, we know we have not been right been to help in that, right? The suicide rate, the all of
mm,
the so but what would make the most impact? If I had a bucket of money, where would I spend it to change
yeah,
outcomes? And so we are, and you start looking at value-based care programs in primary care, and they've got 50 different KPIs they look at, right? Key
yeah,
indicators. And for us, it's really about, right, C-section rate. It's really about, NICU stay, which you and I both know hospitals sometimes somewhat control, or
mhm,
can. And you also know, right, every obstetrician talks about my patients are the highest of risk. Well, we can actually take that data and say you have a high C-section rate and you have the lowest, let's just say, right, of risk
yeah,
in patients. So we need to get one layer deeper than just
yeah,
gather and report. And that's where
mm,
I get excited. Gathering and reporting it has worked. I mean, it's lowered some
yeah,
C-section rates, and it definitely gives insights just by reporting, but there's a deeper level to get to. And
yeah,
so whether it's really evaluating what impact, but it's also really trying to tie it to the cost of care too, because we know NICU stays are very costly. We know C-sections are costly, right? And
yeah,
low birth weight, right? Or severe maternal morbidity, excuse me, yeah, morbidity. Where can we affect that? Because we know the cost of the system is huge in those places. And
yeah.
so I think the next layer deep is to get to what has the impact. And I
Mm,
think approaching it through SDOH is really, really important, needs. So is it getting housing stability? Is it food insecurity? Like, what has the biggest impact? Because we kind of say it's all the things, and it is all
yeah,
the things. And I have my bias of behavioral health, and maybe that's my bias because coming from the prison, or maybe, right, like,
yeah,
I fully admit my biases here are that behavioral health can make, right, as we see the numbers, especially mortality numbers with suicide, there's gotta be a way to intervene there, um,
yeah,
and move the needle, and so, on several things, right, on cost of care, but really on outcomes. So again,
yeah,
I think of the data we have, the data we need to go a little bit deeper on, and then we've gotta,
mhm.
is it causation? It's probably the wrong word, but, someone smarter than I will come up with it.
Uh-huh.
But I think that is kinda where you can start talking about quality measures, but we've gotta lean into kind of one layer deeper,
Yeah,
I thought.
yeah. No, I appreciate that. And I think, through our conversation, you've alluded to some of the good work that Lucina is doing and has started to do. Can you tell us more about Lucina?
Oh, sure.
What
Yeah.
is it? Where would we, as people outside of the company, ever access it, or is it only kind of within those who partner with Unified Women's Health?
Actually, it's not. It's really
Yeah,
we are partnering with payers. And this is partnering is the wrong word, right? Payers are our customer. So we take their
yeah,
data and we can tell the payer who's pregnant within the first trimester, and we take about 7,000 different attributes to figure that out. So imagine you go to the emergency room and you find out you're pregnant and there's a code, right? So
yeah,
we take that data and we do that on a daily basis, and we do that for managed Medicaid across the country. Our partners are people like Humana and Molina and Centene, and help churn their data to not only identify the patients but then risk score them. So, right, and you do that as a obstetrician, right?
yeah,
But we're doing it on a daily basis with a bunch of different data points, and
yeah,
trying to have that impact to the patient where there's care coordination and care management happening, and trying to make sure that the patient doesn't bump up to the highest of score, right? Which sometimes,
yeah,
is that inevitable if you're a diabetic or a hypertensive. The whole point is, if right, prenatal care is preventative care. So if we can,
hmm,
right, to get and so that's how what we do. We do, and we are doing that outside of Unified for practice,
okay,
right? And so we also so that's one of our sort of SaaS products. We call it Discover.
yeah,
And then the second product that we have is really about an integrated care model where we embed care coordinators and care managers ourselves. So we actually hire them, not the payer, to do the care
yeah,
coordination and care management. And we're doing that in Florida. And we're doing that with
yeah,
Sunshine in Florida. So that's Centene, Florida,
yeah,
and really excited to see this work move. We are actually putting our fees at risk. So our fee comes from identifying mom, but also identifying baby, because we need both outcomes, right?
yeah,
And what we're doing is the care management and care coordination by embedding them within unified practices as well as remotely. So we've got both, because we all know we need both, right? You can't just
yeah,
have them in the clinic.
yeah,
And we're doing that across the state of Florida with Unified.
amazing.
And part of that
Yeah,
has really been the medical director, Dr. Aaron Sudbury in Florida. Sunshine has been really pivotal, the first to kind of say, we'll do this.
yeah,
And then we just said we believe in our process, I would say,
yeah,
our risk stratification, but also our care coordinators, care managers, that I'm willing to say, you know what, I think we're gonna reduce that cost, and let's split the cost savings, right? And so truly a value-based product, so that
yeah,
if I don't save, you don't have to pay me.
yeah, yeah. No, I mean, you said this earlier, but I think when I spent my time kind of hemming and hawing over the problem that is, like, prenatal and postpartum care, or let's just say in general, like, maternal health care,
Yeah.
I really did think that the ideal is like a home, like, home care model where home in different ways, like home in, you have someone, a provider actually literally meet you in your space, whether it's many horrible things came out of the pandemic, but did teach us that we can do a lot of great stuff virtually, or someone physically coming into your home. I think one of my dearest friends actually had both of her kids. She's a win-win all around. She's Finnish and had both of her kids in
Oh,
Germany, which meant she just has access to great parental leave
and
and had great maternity
yeah,
care and had a midwife for her first couple
yeah,
of weeks postpartum who came to her house every
yeah.
day and was able to, was there to check in on her and the baby and was able to identify when she had, like, postpartum blues and all this stuff. So there's like the at home experience that we talked about, but then also in one care center, right? Like the ideal to me is like you come for that appointment. I identify that, say you're postpartum, identify like, yeah, you seem like you're really struggling with lactation. Like that lactation consultant's just around the corner. She has slots booked so you can just go around the corner.
Yep.
And then
One
yes,
stop shopping.
your yeah, your lactation needs are exacerbating your postpartum anxiety. Like next you're gonna see the therapist and then on that so on and then forth, and that what normally happens in this fractured system that I am honored to serve in, but I'm frustrated by, is I see all the problems. I'm listening to this mom and I'm like, oh, like God, you're
She
emotionally,
needs all
physically
these
wrecked.
things. Yeah.
You need all these things. Here are some referrals. Here are some lists.
Good luck.
make some calls,
Yeah,
right?
good
I
luck.
hate that.
Right.
I hate that. So I think
Exactly.
that the idea
This
is
is the
something that
care
is like
this
fully
is it.
embedded.
Right.
Yeah.
So we, even though I'm an obstetrician, these care coordinators, care managers take your plan and then say, Dr. O is recommend whether it's meeting them in the clinic or virtually, we are going to help you get, let's say you find, and we've had this just recently, patient said, I'm addicted to opioids. I have
Mm,
been since my last C-section. I'm buying Percocet, who knows if it's right,
mm.
and I'm willing to
Yeah.
get help. What would you do, right? Right? Like, that is, like, the
Yeah.
moment, right? And
Yes.
and we can not just say, acknowledge, help, hold all the things, set up the appointment, get them in, get them transportation to the appointment, all of that, wrap around
Yeah.
and get them there. Okay, now they're like, "I don't wanna go." So how do I go back to Doctor O and say, "I think you need to have a telemedicine appointment again," right?
Yeah.
She's got the transportation. She's now admitting she's terrified, right? And she needs one more oomph to get past that threshold and the meaningful that, right? And get the
Mhm.
partnership together. And so we as care coordinators, care managers don't change the plan, right? And it's you make the plan, right? Whether it's the diabetes, the hypertension, all the things, but we help navigate, reinforce, educate, and can really make the difference for those outcomes because we're doing all the touch points that you just can't as an obstetrician. You don't have the
Mhm.
time. Midwife, you don't have the time.
Yeah.
And you care enough, right, to want to do it, to give the numbers, to give the referral, but it's, right? Oh, didn't fill my test strips, or, I couldn't figure out the meter. And yes, I went to the diabetic education, or no, I didn't because I've got to work till, all hours. And
Yeah.
so understanding and having, and again, this has been well studied, more touch points with patients to get them the care they need where they are with a
Yep.
trust, right? And embedded with the provider who, by the way, Unified has NPS scores through the roof, right? You trust your provider, right?
Mhm.
We want to leverage that relationship and
Yeah.
really get to the patient where they are. And so,
Yeah.
and knowing, right? When my insurance calls to make sure I'm getting my mammogram, I don't pick up, right? So,
Yeah.
just being honest, went right to
Exactly. I'm like,
voicemail.
yeah, screening that call.
Yeah,
Yeah.
right, that went to
Yeah.
voicemail
Mhm.
when the tire popped this morning, but
Yeah.
right? And I was like, "Yeah, I didn't deal with that." So,
Yeah.
right? And so this is not the payer, right? This is the provider
Mm.
being part of it, and screening for SDOH, screening for behavioral health, all the things that, right, you've had the patient probably that has said, "Yeah, I've been thinking about suicide. It's been that bad." And it's
Mhm.
like, "Whoa, whoa, whoa,
Mhm.
now I gotta ask if she has a
Yeah.
plan, and I don't know what to do." Right? And,
Yeah.
I can't just write Zoloft and walk out of the room, right?
Yeah.
Or empathize or all the right? It's how do I shift and figure this out?
Mhm.
And to have the support for the provider to be able to do that in an effective way and really feel like they're making a difference for their patient, that's what we wanna do. And so
Yeah.
realizing right, all the things in my schedule that would drive me, it's not that it was insane because I just felt like, "Oh my gosh, you just articulated really well. Here's the list. Good luck." Like,
Yeah.
so, yeah, so that's what we started, and we're doing that in Florida right now, have opportunities to do
Mm.
that across the country in different both unified and non-unified providers.
Yeah.
And we're kind of triangulating between payers and providers to kind of get to that space of value-based care, which I think maternal health has tried in different ways. I
Yeah.
think because we have a lot of the data and now have really figured out the care coordination, care management are able to do that. I left Mississippi this morning, as we talked about. We're working there and really just doing our identification with the payer. We're not
Yeah.
getting to the care coordination, care management because it's kind of baby steps to get there, but
Yeah.
really excited that we're helping payers identify the patients that need to be who are identified now and need to be intervened now before they become
Yeah.
the highest of risk. Um, and in the state with some of the worst outcomes, right?
Yeah.
And so how do we, and then start looking at what interventions are really working. So that's kind of what Lucina does and where it sits. It sits within Unified, but we work with, mostly the payers, providers that are unified, and we're on a path to continue to grow and are growing crazy in the last sort of 6, 9 months. I recognize that I think people have started to realize, like, with the data, you can transform.
Yeah.
And that's where what I believe and what I get excited about. And when I was offered this role, um, it was the idea of making a difference and really having an impact. And I would be at the March of Dimes and people would want to give money and they'd always say, I want to give where where we have the most impact. And I would say, March of Dimes doesn't really have all the outcomes, but they have incredible advocacy, incredible
Yep.
programs that they learn from, do a ton, or report on.
Yeah.
But it is definitely my space to be in the provider space,
Yeah.
and this is just one of them, right? So,
Yeah,
yeah.
yeah. No, I mean, something you alluded to earlier was recognizing with maternal health, whether it's women who develop hypertension or diabetes, this is part of their health trajectory. Like this is going to have an impact on them in their latter decades. Like
Yeah,
it's a fact, right?
yeah,
And I think that also what people sometimes don't recognize is that pregnancy is a great equalizer where people who normally wouldn't have access to care because they couldn't, weren't necessarily insured to be able to, or they just otherwise like I'm fine, I'm healthy. Like
yes.
it's not until they're pregnant that they say, "Yep, I prenatal care." We all most people buy into and say, "I will consistently see my clinician in pregnancy and postpartum." But it's such a vulnerable time point and an important time point for us clinicians to identify
Yeah,
patients who are at risk, and really I think a lot of us are getting better at naming. Like when I see my moms who had preeclampsia, I think for a lot of them, they're like, "Okay, yeah, I had this thing when I was pregnant, but like that's it." And I'm
yeah,
no,
mm,
actually, like this is probably a
right.
part of your cardiovascular risk profile. And so there's so many things I think in the realm of women's health, let alone maternal health care, that I think sometimes get underappreciated by those who are more external, because I think people oversimplify, like, you, like, start a family, like, get pregnant, have a baby, move on, like, everyone else has done it, but there's so many different touch points, and I think our amazing conversation so far has not even gotten to all of it. It's probably the tip of the iceberg of the complexity that is maternal care.
Yeah, I mean, listen, I think it is absolutely the stress test, right? And I think if you I guess I imagine, and I hope for my daughter, right, that in the future, right, for her children, if whatever, or other people's children, let's put it that way, for women, really, that we can think of it as a continuum, and that
Mhm,
if we really started earlier and, right, if we started about nutrition and weight loss and all the things, right, and I mean, we talked a little bit about timing of pregnancies a few times here, right? Just about can we really think of women's healthcare holistically and not just,
yeah,
okay, you're in your adolescence, you're in, maternal, and then there's this space in between, and then all of a sudden it's menopause. Like we've just started talking about menopause in a real way now, right? And right,
yeah,
it's now like Oprah's finally talking about it, right? I
yeah.
mean, we've
When
been
Oprah
talking
talks
about it.
about it, it's
You
big.
know it's real. So,
Yeah,
right, and then she's got Gail in there too. So it is
yeah, yeah,
over,
yeah,
right? I think I saw
yeah,
Halle Berry there too and was like, "Oh my god, what a gorgeous woman." But that whole the whole idea that, again, I go back to we haven't researched women well. We haven't really dug into the data. I think that's what gets me excited about being at Unified, right?
mhm,
3 million annual visits a year, right?
yeah,
There's opportunity there to really look at it holistically and really think about a whole women's care. And
mhm,
what does that look like? And that may look really different for a payer.
mhm,
That may look really different for Medicare Advantage, right?
mhm,
As everybody looks in value-based care way over here, why aren't we starting earlier and thinking about it
yeah,
as a continuum? And um, so maybe that as we started this conversation was, right, my approach to my career has been a little bit outside the box. This is to me not that outside the box, but it seems like I keep saying this is that it is an approach I think we have to get to.
mhm,
And I think if we could at least get to that conversation in my lifetime, I will be excited if we get to, some kind of form of it. It would be amazing to be able to do that and really manage patient, care differently.
yeah,
Because I think it gets chunked out and that's not good
yeah,
overall.
yeah,
So yeah, that's kind of my, you know, how my vision of sort of how women's healthcare should be looked at.
yeah.
Um,
I'm with you on that vision, and I think I didn't realize that when I started this podcast, all the different things that the different ways it would give back to me, but one of it is it's giving me hope, it's inspiring me, It's believing that this problem is big and insurmountable as it sometimes feels. When there's multiple people going at it from multiple approaches, we're gonna chip away. Like, even though
Yeah,
we talked about those statistics that haven't changed,
yeah,
it's gonna happen. We've talked a lot about what your team at Lucina is doing,
sure.
how we as clinicians can think about our patients and how we give them care and identify risks, etc. For the moms or the moms to be that are listening, for the patients who are listening, what are ways that they can advocate for themselves and advocate for their pregnancy and postpartum care?
Yeah, I mean, I think the way I think about this, especially women before becoming pregnant, right? Like, come in and talk to the providers. That is a great visit, really, whether
Mhm.
it's talking about how do I approach pregnancy in a healthy way. Um, now conception can be, from frozen embryo to frozen egg, right? I mean, there's
Yeah,
right. So there's so much more to discuss at a time, and
yeah,
about approaching pregnancy, right? Getting on a baby aspirin, big campaign we did at March of Dimes, and that now is, completely different than it was years ago. So,
yeah,
and it's very common to get on a baby aspirin after 12 weeks and sort of that impact it could have. And so
yeah.
we talked a little bit about trust, but making sure you're with a provider that you do have that trust with, or figure out how to build that so that you can, get that established early, I think is
Yep.
really important. And then I would say through the postpartum it is, and I say this a lot, is I don't mind confrontation. Like, it doesn't bother me. Like, I loved it when
Yeah,
people would ask me questions, and actually can even think about some that I was like, "Oh, this is uncomfortable. She doesn't trust me," right? So, and I would say,
yeah,
like, "You don't trust me, so let's really get down to the nitty-gritty
yeah,
of it." And it was actually, I'm just thinking about a VBAC patient that said to me, like, "You don't want me to have, or you want me to have a C-section. You don't want me to VBAC." And I was like, "You know what? I'm nervous about you having a VBAC. You're right.
yeah, yeah,
I'm already
yeah,
coming in with, so that vaginal birth after C-section, like, I was there with your first one, right?
yeah,
And it was scary, all the things, and being really honest about it, and honest
yeah,
conversation. So, and I love, and I was behind in seeing patients, but I was like, "This is a conversation that has to be had now,
mhm,
here and now." So I encourage patients to really probe and ask, but get to a really, a place that they're comfortable, or with the person that they're comfortable with. And so I think those are some things that are really vital and super important. And listen, I mean, I would get, like, the complaint about my front desk about, I'd be behind, or front desk didn't really answer my question. I'm like, they don't really know the answers sometimes, right? And so
yeah,
get past the front desk, and it's this interaction that's the most important. I'm not saying my front desk wasn't vital. They are definitely the face of the practice.
mhm,
Um but I would be like, the most important thing is right here, right now,
yeah,
and try and get to that. But listen, and I'm all like, set yourself up for success. Those, it's not just physical, it's mental, but it's also really, only have 9 months, right?
yeah,
And it could be
yeah,
shorter, right? And
yeah, you never
so
know.
ask the questions and get to that place. I think it's
Yeah,
really important. And I do think clinicians have the intent, the right intent. And I think burnout is real. We talked about that. And people are in different stages of that. So,
mhm,
and so it's also for providers to be really honest about that as well.
yeah,
Yeah.
mm. Thank you, Dr. Shiro. Thank you, Elizabeth. No, it's been an hour plus of just constant like wisdom and thoughtfulness and vulnerability on your part. So I'm just so grateful. As we wrap things up, I mean, in my mind, I've tapped every
Oh, I got
orifice
nothing
of
left.
your brain.
I got nothing left.
But but are there any kind of final thoughts or anything that you're really, we talked about the exciting things that Lucina's doing, but anything else that you're really either excited about or final thoughts you have in the maternal health space, anything that we should have on our radar or should end on?
Listen, I mean, I touched on femtech, I touched on Lucina. I think unified is really a fantastic place to be, and people don't really know about it, right? It's kind of behind the scenes.
Mhm.
Because it's not really, it's sort of like, and I've been saying this a lot lately, because it's sort of when you look at your computer and it says powered by Intel, you're like, I don't even
Mhm.
know what that is, but I want it, right? So,
Yeah.
and I think I'm hoping in this role I'll start amplifying a little bit more about unified and how it's powering the women's health behind the scenes. And so
Yeah.
that would probably be my biggest sort of, because people are like, what? I've never even heard of unified. And so go look
Yeah.
it up. you know.
Yeah.
But no, excited to be, I guess I'm only like 3, 4 weeks into being their chief medical officer. But Lucina, I've been there for 9 months, which is, we're a full term pregnancy and now
Yeah.
for those. So I just appreciate the time and space. And this was so easy and comfortable to do and so calming after a hectic,
Oof.
transportation morning.
Yeah.
So appreciate
Yeah.
you very much and just love
No.
this is fantastic.
No, thank you for yeah, what is it? Trains, planes, and automobiles. But thank you for your epic journey to have this conversation with me. I think it was totally worth it. I hope you agree.
Yeah, loved it.
It was a
Great.
pleasure to talk with someone who intentionally and maybe serendipitously is an innovator in this space. And again, I'm walking away feeling inspired and so hopeful for what we can do for maternal health care. So thank you, Dr.
Thanks.
Cherot.
Thanks very much. Thanks for having me.
Thank you very much for listening to The Golden Hour, the podcast community where moms and moms-to-be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.